Hello friends, my name is Dr. Lt. Colonel P. Prabhakar. I am the Clinical Director and Head of the Department of Orthopedics and Joint Replacement at CARE Hospitals, Nampally. Shoulder replacement. Now this is something which we hear quite often nowadays. We obviously are familiar with the more common varieties of joint replacement like knee replacement, hip replacement, but these are among the newer kids on the block which have gained a lot of traction, a lot of popularity in the recent years. Now, a shoulder replacement, exactly what is it and who needs it? Today, I'm here to give you a little bit of an insight as to what is it that we do and who are the patients who would probably benefit from it. When we say a reverse shoulder replacement, this is, in effect, reserved for those people who have a severely painful and arthritic joint of the shoulder, resulting in severe disability in the form of restriction of activities of daily living, which means basic functions of feeding oneself, clothing oneself, and perhaps perineal toileting as well. So when we are faced with a situation like this, it can be incredibly challenging for a patient to be self-reliant and independent. This commonly results from one or two conditions. One of them is a rotator cuff tear, which perhaps has been there for quite some time and is not really repairable. Second part of it is if it is a severely arthritic joint with severe changes where joint space narrowing and the cartilage has got damaged very severely. The third condition, of course, is in cases of elderly who have sustained a severe 4 or 5-part fracture of the proximal humerus, wherein reconstruction or fixation methods may not work owing to the osteoporosis or severe weakness or combination in the fracture fragments. So in all of these, what we effectively do is the shoulder is a ball and socket joint. So we effectively reverse that. So the ball goes on to the glenoid side, which is the inside part of the shoulder, and the cup comes onto the outside. Now this gives it inherent stability. So even in conditions wherein the rotator cuff is not functioning, the other accessory muscles like the deltoid contribute to the function, and it provides a stable lever arm. And therefore, the individual are able to carry on with their basic functions and remain independent, which is primarily the focus of this particular surgery. In cases where there is post-traumatic situations and reconstruction is not possible, in those cases, this gives us a one-stop solution for getting the patient self-reliant and without the suspense of an initial fracture fixation, which may perhaps fail later and result in much more debility and disability. So in this particular case too, it is invaluable. The third case, of course, in cases of severely painful joints, where our primary focus is to alleviate pain, those two will benefit from this particular procedure. If you are a patient or you know somebody who is suffering from this particular condition, you can feel free to reach out to us and perhaps we will be able to offer a solution to you. Thank you.